Welcome to Red Flags Question and Answers from a Pharmacist. I am Chelsea, a retail pharmacist, giving you a look at life behind the pharmacy counter. And I'm going to start answering the most common questions that I get about pharmacists and red flags in regards to controlled substance prescriptions. But before I get started on the actual questions and answers, I want to talk about a very important couple of things. Number one, safety and legality have always been part of the job of the pharmacist. However, our responsibilities did shift and change back in 2016 when the government basically decided that pharmacists were responsible for the opioid issue, and now there are additional safety checkpoints. Number two, I do think that the pendulum has maybe swung too far in the other direction, and I think that it is increasingly difficult for legitimate patients to get the medications that they need. While I am all for additional safety checks and pretty little, guidelines, I do not like those things at the expense of my patients. Number three, I do not like the term red flag, honestly, and I don't use it in practice because I think the term red flag is stigmatizing, and this is already a group of patients who feel stigmatized enough, and I don't want to contribute to that. So instead of saying red flags, if I'm having a conversation with a patient, I'm going to say I have a safety concern or I have a legality concern, and I'm going to do everything in my power to resolve those. How did red flags come to be? Kind of a combination. DEA, boards of pharmacy, the government came up with a guide for what pharmacists should be looking for when dispensing controlled substance prescriptions. And while this idea is great in theory, it is now kind of being treated more like a checklist versus a guide. And I do not think that is what it was intended to be. In addition to that, I think that if a pharmacist is actually going to refuse a prescription, I strongly believe that they owe the patient transparency and honesty, and they should tell them why the prescription is being refused and also help them navigate the next steps instead of leaving them in limbo. So make sure you're following along while I answer the most common questions that I get.